Hello and welcome to another video from me, this tutor, and in this quick video I'm going to be talking you through all the facts you need to know for the medieval and Renaissance surgery topic. Okay, so this video is going to be mainly focused on the AQA exam board. I'm going to be talking you through some of the key facts, also talking you through some of the skills to consider for the question, so significance, factors, but also how our time period is similar. Use this alongside my revision guide. You can find it in the information attached to this video. My revision guide also has how to answer the questions. So once you've revised this, you've watched it a few times, you can get to my revision guide and practice questions. I talk you through how to get a top level answer. Okay, so now watch this and learn the key facts and information. Okay, so we're going to start with the medieval time first of all, and obviously in the medieval time it's a time of very limited skills. We have the main problems of bleeding, infection, high death rates, pain, all these things are around. So we start with the first sort of big development, which is the barber surgeons. So as the name suggests, these were barbers. They cut hair, they did shaving, but they started to be employed more increasingly, particularly in monasteries, to perform bloodletting. In the 1200s, though, the monasteries were banned from allowing bloodletting in their infirmaries and wards, so therefore the barber surgeons had to leave and set up on the high street. So therefore we get the barbers on the high street. They, as high street practitioners, had to have a guild, which is like a union, and they had to be trained for 7 years as an apprentice if they were in a guild before becoming a master surgeon. So we led to increasing education and expertise amongst the surgeons, which was a good thing. As a little interesting aside, obviously, the barber pole does represent the fact that it's red for blood and white for bandages. It represents this idea of the surgery of an old-fashioned barber. For those people interested in that little side fact. So we've also got, obviously, surgeons going off to medieval battlefields and learning new things. So John Bradmore, in this time period, got a bit sick and tired of pulling out arrows from people's bodies, so invented a special arrow head removing tool, which developed surgery in the 1400s. Barber surgeons obviously were doing bleeding as part of the four humours. The idea that there was too much blood in the body is making people ill, so they developed special equipment for this. In particular, developed a fleam, which was a special knife that had on the back of it a little sort of bit that allowed the blood to run smoothly down the back of the knife into a bleeding cup, which obviously could measure the amount of blood that was being bled. So it was a bit more accurate than the doctor simply bleeding you with leeches. They'd also amputate people, so if you had infected limbs, they would cut them off and then they would seal the wound shut with a cautery iron to burn the wound closed to stop you bleeding to death, and also perhaps to stop any infection they thought might be around. They didn't have much pain relief, so all of this was very, very painful for them. They could use alcohol. Some places might have access to opium or mandrake, some things that could be used to stop pain, but pain generally was a very significant problem in this time. Of course, infection was also a major problem. They didn't understand about bacteria, so everything was dirty. The tools were dirty, tables were dirty, surgeons were dirty. The main thing to focus on was obviously being quick to cut off a piece of flesh rather than dealing with infection. In fact, some people thought that actually pus, infection, an affected wound that showed pus was actually good. Some people talked about praiseworthy pus being sent from God as a good thing to help things heal. Now, progress was slow. The church banned dissection of human bodies. They didn't like bodies being interfered with after death, so it was interfering with God's creation and the afterlife. So therefore, people could not question Gellen's ideas of anatomy. They could not check whether things were correct. So people still relied on Gellen's ancient books, which were mainly based on the anatomy of animals. People also were superstitious about this surgery. They might believe in astrology. They might believe different parts of the body were connected with different alignments of planets or the moon, and therefore that was the thing that needed to be bled or operated on to deal with a problem. So they might have had an astrology man chart, as shown in the picture here, to help them work out where to cut, where to bleed, etc. There were some complex operations. So trephination or trepanning was something that people are doing since ancient times, and obviously they could still do it in this time, and that might deal with what they might try for things like migraines, but obviously what they could really deal with is pain in the head. Maybe somebody's been concussed, or they've got, modern times we talk about having a bleed on the brain and then sort of allowing to release the pressure, so they might have been able to do this operation. And obviously they could do cesareans where they removed babies. Okay, so those were the two more complex operations. Specialised surgery did develop. So John of Ardenne is famous for being a surgeon of the backside, of the rectum. I imagine he made quite a lot of money, because I imagine this is something that rich knights who had problems sitting on their horses suffered from. So he probably chose a good area to work in to make some money. We can't also forget Arab advances in surgery as well. So we need to be aware that there were important Arab doctors helping surgery. So Ibn Nafis suggested Galen was wrong about how blood flowed around the body for anatomy. Obviously, there was a lot of sharing ideas about bleeding. Rhazes and Ibn Sina had the canon of medicine, which shared the ideas of Hippocrates, and Galen about bleeding. And in fact, a lot of the ideas about Galen and Hippocrates were stored in the Arab world and were shared from there. Infection. Surgeons on crusade learnt about the ideas of Albucasis, who said that praiseworthy pus was wrong, and therefore they started to remove infection and clean wounds better in the West. So what's the significance of medieval surgery? So long-term problems still remain. So the long-term problem of they didn't really deal with infection, pain or bleeding. They didn't solve any of the major problems particularly. Size and scale. Many people believed in the ideas of Galen and Hippocrates, so therefore bleeding was very, very common, and it was common until maybe the 1800s still in some respects. And the loss of anatomical knowledge was wrong, and that's going to last until the Renaissance. In terms of the long term, also the barber surgeon and the guild of surgeons developed. So there was something useful to consider here, a guild of surgeons, which later was expanded by Henry VIII into more of a sort of national enterprise of learning and specialisation. So it helps to improve surgery. In the short term, there's problems about the church banning spilling of blood on holy lands, but that has a short term positive impact, that the surgeons have to go to the high streets and join guilds, which means they start to be trained as master surgeons. There's lots of factors helping and not helping. So religion is the big one. So obviously religion helped the development of barber surgeons. Religion set up universities which started to train surgeons, and by the 1300s they were starting to do public dissections. However, religion encouraged false ideas like praiseworthy pus, and they banned dissections, which stopped people challenging Galen. War obviously is really important, and it's very simple for a candidate to say, oh, war helps surgery, but you need to have some really good examples of that. So the Crusades is one war that led to the end of praiseworthy pus. It led to the sharing of ideas by Arab doctors. John Bradmore developed his arrow removing tool at the Battle of Shrewsbury. So these are really useful things to consider. Individuals, obviously, we've got John of Ardenne specialising in surgery, so that's quite a good one. And communications, a bit of a positive and a negative. Obviously, the books of Galen were shared from the Arab world. It gave lots of correct things, but also some incorrect things. And finally, obviously, the government had town laws that suggested that you, as a member of the guild, you had to have 7 years training. So on to the Renaissance now. Okay, so we're typically thinking Renaissance 1450 to about 1800 here. Okay, so barber surgeons still use cauterization, burning, and they use burning oil to seal wounds now at this stage. So we've got the invention of better technology like guns, and so picking out bullets from bodies, and they're using burning oil. So cauterization's improved a lot more and is more and more common now in surgery. Surgery also remained very dirty. Clothes were dirty, equipment dirty, very unsterilized. Blood loss was a major problem because weapons, as I said, have improved. So bits of limbs and things like that blown off. Blood loss could be a real problem. And pain was a major barrier to the development of surgery. So there was awareness that they wanted to do better surgery, but people being awake meant you couldn't do better surgery. So there was some surgical improvement. So we could be aware of Paracelsus, an alchemist who made a drug mixing opium with alcohol called laudanum, and this could be used as a painkiller. And Thomas Sydenham in the 1600s started selling laudanum around the UK. He was a quack doctor. So you could have access to slightly better pain relief if you could find it. So Andreas Vesalius helps improve, of course, anatomy. He found that there were 200 errors in the work of Galen by dissecting lots and lots of bodies. So some of the errors he found, of course, was the jawbone was one bone, not two. Blood did not flow through the middle of the heart, as they must have done something else. The liver did not make new blood. The kidneys were not at different heights, but were actually level. So he found lots and lots of errors. He got artists to help draw his sketches in detail, and he published everything in his book, The Fabric of the Human Body, in 1543. This was translated by Thomas Geminus and was then published in Britain. So if you want to think about the importance of Britain, it'd be good to know that Thomas Geminus published his book. So what's the significance of Vesalius then? So we might get a significance question. So he gave excellent understanding of the human body for the long term, and this led to the long-term end of Galen's ideas. Importance. He showed that the important institution of the church was wrong, so he challenged the important ideas of the church. Short term, he encouraged people to question Galen's ideas, and you could link that to Harvey, who is then going to go and find more about the circulation of blood around the body. Vesalius has said it's not made in the liver, and it doesn't go through the heart, so there's a mystery to be solved. Today we still use the scientific experimentation, his knowledge on anatomy, his dissection ideas to investigate. So he's an inspiration for investigation. And obviously size and scale, his books were published in many languages. Around the world his books and ideas went, so really important in terms of size and scale. Paré is our second key individual. So Paré was obviously a French barber surgeon. He went to war and he really didn't like being a battlefield surgeon, so he started to make some improvements. So improvement number one. He stopped using hot oil to seal wounds. Instead, he took a chance on an ancient herbal oil he knew of, which involved egg yolks, oil of roses, and turpentine, and this worked much better. The patients were not in pain, they recovered better. His improvement number two was his crow's beak, and he's a bit of a genius for inventing this, yeah? So the crow's beak would be for sealing an amputation. So you cut a leg off, you then crow's beak, shut the artery closed, and then you use a ligature to sew up the artery. So you're not using a cauterization anymore to close the wound, you are using a ligature, and you're stopping the blood loss with the crow's beak. Improvement number three, again a bit of a genius. He was the first person to start making artificial limbs with any success, and he had them in his books as well. Okay, so we need to be aware, obviously, of did people really accept his ideas? Okay, so Vesalius' ideas were quite well accepted after a short time, but Paré's were maybe slightly slower to accept. So people didn't really want to get involved in ligatures and crow's beaks because a cautery arm was much easier and faster and required less skill. Imagine your naval battlefield surgeon on the boat. It's going to be quite difficult to use a crow's beak and a ligature. Richard Wiseman in England advocated cauterization and criticised Paré's ideas. So positives though, an English copy of Paré's book, Works on Surgery, did appear in the Library for the Barber Surgeons of London in 1591, and William Close published many of his ideas in his book Proved Practice. So then we're on to the significance a bit more. So obviously Paré started the end of the cut it off and cut it out surgery and started the idea of repairing people's bodies rather than just cutting things off bodies. So there's a long-term idea there. Importance, he became the surgeon to the King of France. Okay, so he's a very important, significant person. Short term, he started to end the problem of pain and bleeding. He controlled bleeding with the crow's beak, and obviously pain of cauterization with the ligature and his oil of roses herbal oil. Okay, today we still use the ligature and the crow's beak. It's still a basic tool of surgeons. And obviously his books were published in many places, so a big size and scale, big impact around the world. So next, third person, William Harvey, obviously English doctor, studied in Padua. He is going to solve the problem of the circulatory system. So he's a bit of a genius for his development of his operations and his experiments to do this. So he worked out that you could vivisect cold-blood animals. So they were alive, and because they were cold, you could watch the heart moving slowly and the arteries and veins moving the blood slowly to work out circulation. And this experiment helped him work out that there's a one-way system around the body. Arteries would go away from the heart, veins back to the heart. So through his experiments, Harvey concluded that Vesalius was correct. The liver did not make blood, and the blood did not flow through the middle of the heart. In fact, it went round the body. in a circulatory system. Harvey suggested there were microveins and microarteries that were at a tiny, tiny level, which we couldn't necessarily see without a microscope. He published all his books in his book on the motion of the heart and the blood. His importance then. So Ryland didn't think he was very important, called Harvey a bit of a quack, and Hoffman called him an accountant as he counted blood. But his book was published widely, and obviously today it's important in terms of understanding the circulation of the body, and eventually, once blood groups have been discovered, important for things like blood transfusion and solving the issues of bleeding. So, the significance of Harvey, obviously he improved long term that the heart and how the circulation system works, and obviously important for modern medicine. Importance, he was surgeon to King James and King Charles in England. Short term, he proved getting wrong about anatomy, heart and blood and liver, and of course, if you're saying that blood does not get made in the body and it's just a regular amount that goes round and round, of course, he's disproved 4 humours. 4 humours now cannot be a theory to use because the blood just goes round and round. Today we rely on his anatomy knowledge for modern surgery and medicine, and his books were widely published again, so successful in terms of size and scale and ideas. So did surgery change Renaissance Britain? Well, the surgeon to King Charles II, Richard Wiseman, still used old ideas like bleeding. Many surgeons found new ideas difficult. Infection was still a huge problem, and dirty ligatures added more infection if they obviously just had ligatures lying around, they weren't clean. So silk ones obviously easily infected, whereas the catgut ones you could wash them. So although Wiseman did start to use the ideas of Paré later on, the books of Vesalius and Paré were obviously widely available, and by 1700 surgeons like John Hunter were using invasive surgery by removing internal tumours. He was very much in the repair idea, so he had developed ideas of rather than cutting large amounts of flesh off, actually cutting small bits off and starting to bypass around things, so that he was repairing the body. So factors impacting surgery during the Renaissance. Obviously chance. Paré took a chance with herbal oil. You could say Vesalius took a chance with the dead bodies. War. Paré, lots of ideas during war with his crow's beak, his ligature, his herbal oil. Individual genius, we talked about Paré's crow's beak, Harvey's experiments. Communication, all the books they've written. Lots of experiments like Harvey's vivisection, and government, Henry VIII setting up the Barber Surgeons Union to really push forward surgery. And finally, you might want to think about how the surgery of the medieval and Renaissance time are similar. Okay, so the better answers will be the more complex ones. So there's some basic similarities. Both had high death rate, as you can see there. Infections were a problem in medieval time. They believed praiseworthy pus was good. Death rate was high in surgery. In the Renaissance time, guns and cannons led to more infection and actually inside the body, and broken limbs getting dirty and infected. Operations were painful in both time periods. Barber surgeons in both time periods had to be fast to cut off the body, so a good barber surgeon was a fast one. And obviously in the Renaissance time there were even more wounds as bullets and muskets were developed. So hot oil was poured into these wounds, which obviously made it very painful. So you could talk about more complex ideas. So in medieval surgery, war helped to develop. Now, it's very easy to just say the word war. We need some examples. So in the Crusades, Hugh of Lucca realised that praiseworthy pus was bad. John of Bradmore developed his arrowhead removing tool at the Battle of Shrewsbury. In Renaissance, we got Paré, his hot oil, his crow's beak, his ligatures, all inspired by war. And specialism developed. Okay, so John of Ardenne specialised in rectal surgery in medieval time. By Renaissance time, we've got specialism with Vesalius, learning about anatomy. So people are starting to specialise in different fields of expertise. Sorry, please allow me to interrupt just for a moment to tell you about some of the other services I offer. So look at my website, historytutor.co.uk, to find out more about history tutoring if you want help directly one-to-one, or if you've got a small group of friends who want help, then look me up. Also, if you want more information about my revision guides, they're available on Amazon. They are packed full of revision notes, all the essential facts, organised into revision cards or simple forms you can just look over again and again to revise. Packed full of videos helping you answer questions. I tutor you through how to answer all the different types of questions. Lots of videos explaining how to do this. Some of them are free on YouTube. Look me up for more videos, but you'll find more and more videos on my revision guides. So take a look. Well, I hope you found that useful and it's really got your knowledge improved and thinking about the questions as well for the exam. Now, Using my revision guide, my other videos now. Try a question, okay? I will talk you through how to answer it. Use this new knowledge to test your skills. Right, bye bye for now.